These are real survivors of domestic violence. They believe in building relationships with their healthcare providers.
I think the importance in developing a relationship with your healthcare provider, it stops the barrier. I feel like sometimes there's a line there that they won't cross because it gets too personal.
Building a relationship with healthcare providers is very important. I feel as though that was the thing that allowed my children to really open up, because they had already had a rapport with their primary doctor, and she was the one who first, they informed her of some of the things that were going on.
If they were to come into the room and just sit down and it was just a chat, how are you today? And I've had this happen with my gynecologist, actually, which I don't mind saying, by the way. It was about what I was feeling in that moment. Came in, sat down, what's going on? What can we help you with?
Are you postpartum? Are you eating? Are you breastfeeding? All of those things they're asking are very personal and intimate questions. So I feel like the line that they say, I can't cross because, I'm a doctor and they're my patient, I feel like that's a cliche, because everything that we're confiding in them is very personal.
So it's very important, because a lot of people won't share if they don't feel comfortable, especially kids. They don't really know, who they could say different things to.
It's confidential, it is safe, and it is open to not just medical things, because not everybody's going to think their environment is a medical thing. Not everyone's going to think that their mental health is a part of their physical health, because not everyone knows that information. And if you go in assuming that they know that, you're not going to connect the dots.
So I feel like it's very important to do that, so that, every life that is in their room could potentially be saved by the provider knowing that this isn't just business, it's personal. That would be the opportunity that won't be a missed opportunity. I feel like if that was something that everyone was able to experience, people wouldn't have an ideology of what they assume will happen if they did speak up when it comes to domestic violence.
For additional information, support, or resources, the 24-hour, 7-day-a-week National Domestic Violence Hotline is always available. Thank you for doing your part to support survivors. Becoming educated is the first step to change. Help us spread awareness about domestic violence so we can continue to help the individuals affected. In partnership with Lutheran Settlement House Bilingual Domestic Violence Program and the Survivors Network in Philadelphia, PA, and the Children's Hospital of Philadelphia, we thank you.